Hey moms, my name is Christine of Super Mamas and I'm joined by Shiro Shriera of Nurturing Moms, and what we are doing is empowering you on matters breastfeeding. So what happens sometimes, you know what to do. Shiro has empowered you on all tips breastfeeding. But what happens when your baby is having a challenge? So Shiro is here to empower us on the kind of challenges that your baby could be facing. You're doing everything possible. But there could be something that you need to look out for in your baby. So welcome to today's conversation. Shiro.
Yes.
Very nice to have you as usual.
Thank you.
Yeah.
So one of the challenges a baby may be experiencing is having a tongue tie or a lip tie.
Tongue tie.
Tongue tie. So you see, your tongue tied, your tongue is actually literally held down. So if you lift your tongue, we have something called a frenulum right at the back.
I can see yours.
You can see it.
Yeah.
So for some babies, it extends to the tip of the gum area. So they're not able to extend their tongue out to massage the breast and to breastfeed. If you notice that, and how do you notice? There's still a clicking sound.
When they breastfeed.
Yes, there should never be a clicking sound when you're breastfeeding. There's a clicking sound. You're still having sore breasts. And it's like your baby's not getting enough. They're not getting full. What you do, you go to your doctor first and tell them, this is what I see. I've even tried to lift my baby's tongue and it looks tied down.
Right.
It will just be cut. They'll cut it, release it, and give your baby back.
Same day?
Yeah. Go home and continue
No
to
bleeding?
breastfeeding. It may bleed us slightly, so that you put pressure with a cotton wool, okay? And then you breastfeed.
Okay.
Another issue with breastfeeding for babies, some of them get thrush.
Thrush.
Yes, oral thrush. So when they open their mouths, their tongue looks coated with a white coating.
Yes,
inside the cheeks, there's like little white spots. So when a baby has oral thrush, some are not affected and continue to breastfeed, and some do.
So is thrush fungal? Is
It's
it
a fungal.
bacterial?
Yes,
it's
yeast.
a fungal infection.
Yeah.
What
And
causes it?
yeast, it just loves warm, moist environment.
Right.
So sometimes if your baby has a cake of white on their tongue, I'd try to wipe it off. So you can get a washcloth, wrap it around your finger, dip it in some water, and just try to wipe
You
the
know what I'll
tongue.
be tempted to do, Shiro, if I am a new mom, that every other day, I'll then get the wet cloth and just
Do it. No, you don't have to do it every day.
no.
No, you don't have to do it every day. Maybe once or twice a week. And how do you get your baby to open their mouth? You just put your finger and press their chin, and somehow they open and extend their tongue. Okay? Then there are these grooming kits that have a thimble. These days they have a thimble in it where it has like bristles. You put it in your finger.
Right.
You can use that like a brush to brush their tongue.
Okay.
Okay. Now, if your baby has thrush, mom should also protect herself. She may get thrush either from her baby or the nursing pads she's wearing all the time. That you remember, yeast loves warm, moist environment. So you're always wet with your pads inside. It can
breed on the pads.
So wash your pads and change them often. If it's a baby, whatever baby is being treated with, apply it on your breasts, because you'll be breastfeeding was going okay. All of a sudden, why am I feeling pain? Why am I feeling itchy on my nipples? Why do I have shooting pain even without breastfeeding? It sometimes is a thrush.
It makes me wonder, now that we are talking about the challenges for the baby, how does thrush affect the baby? Should I be worried? Will the thrush poison the baby's blood? Or
Yes, so that's what I was saying.
happen?
For some babies, they have no symptoms and they're okay and they'll feed well. Other babies, they don't feed well.
Okay.
Okay, so they're latched on and they're not enjoying it, so they're not feeding well. Okay, another challenge is reflux. So reflux, usually the baby, when you put them flat, there's some milk content that comes back up.
It is scary when you're a new mom.
Yes.
It is so scary to watch.
Yes. So it's like heartburn and can come out through the nose, through the mouth, or they're coughing, they're choking. And every baby is born with a sphincter. The abdominal sphincter is open and it shuts at 6 months, the valve. So it will close at 6 months. Before 6 months, it's open. So if they overfeed or there's a gas that's coming up very forcefully, it comes up with some milk.
Okay.
Yeah? So what do you do with reflux? When it's really bad, there are babies who associate the breast or feeding with pain.
So of course they will start resisting breastfeeding.
Yeah, they get an aversion to it. They're like, no, this thing is
giving pain.
Yeah,
No.
so I don't want. So that would be, it has been happening. The mother has not noticed because there's something called silent reflux that you'd need to be checked. So what you do, try and feed your baby at 45 degrees. If you're changing a diaper, always put them on like an angle.
Okay.
If you're sleeping, elevate the bed.
Okay.
so that the mattress is at an angle.
Elevate the bed.
Yeah, the mattress, not the whole bed, the mattress. So put something under where the baby's head will be. You know how the hospital cots are?
Yes, yes.
Yeah, that it's slightly inclined. That's
yeah.
what you want. So if there's any stomach content going up, gravity will make it come back down because the baby's at an angle to avoid reflux. I actually did it with my kids, whether or not they had reflux.
I never experienced it.
My son would spit up a lot. It's called possetting. It's not reflux, but he overfeeds, so he just... He burps and it comes out, and he could be smiling, half asleep, and
you're the one who, whoa.
Yeah, what is all that? But he's comfortable. Moms confuse that with vomit. Vomit is that forceful ejection of stomach content, and it actually looks scary for the baby. But possetting is like a teaspoon or 2 of milk that comes out.
Okay.
Yeah.
I then wonder, are there kids or babies who are born who don't want to be breastfed and we don't know? Do you think, in your experience working with many moms and babies, all babies
majority, unless they're sick,
milk.
unless they're not well. If your baby is not feeding, they could be unwell. I got a call the other day from a mom with a 4-month-old baby, and she said, for the last 2 weeks, my baby has refused to breastfeed. Can you come and just... So I did it over the phone. I'm like, tell me more. Yeah. So she says, my baby's not smiling anymore. They just look unhappy. So I asked her, is your baby tugging on his ears?
That's the other thing.
And she said, yes, he's
ear
always...
infection.
There you go. But not every mom knows that.
No.
So I said, your baby has either an ear infection or a throat infection. I wouldn't do anything now. Take him to the hospital today. She calls me back. And
baby's fine.
No. The baby had a throat infection.
Wow.
Yes, that's why the baby's not feeding. They're unwell.
Of course, ear, nose, throat, always connected.
ENT. Okay? So also check, is my baby okay? You think they're fine, you're doing everything, why are they not feeding? There's
overall
something
health,
wrong.
yeah?
Yes.
Very important.
There's something wrong.
All right, as we are winding up this conversation, I know it was brief, short, and sweet. Challenges that the baby could face, you've mentioned reflux, thrush,
tongue tie.
And tongue tie.
Yeah.
And of course, you've said that most babies love breast milk. So
They
it is
do.
impossible
For
a baby out there.
Disclaimer though.
Unless
they're sick.
An underlying medical...
Or the mother has introduced something else before the breast.
I know you don't want to say which.
If you introduce something else before breast, guess what? The baby might want that other thing before your breast.
Yeah, and you've shared these tips before. Breastfeeding is so important. Whatever you can do to get your baby to love, you know, that process with you and enjoy breastfeeding, it's such a nurturing process. So intimate and beautiful.
Yeah, beautiful.
Yeah? So not to give up. If the baby is having a challenge, of course, they can always reach out to you for any more tips. How can they get to you?
You can get to me on Nurturing Mums. Nurturing Mums is on Instagram. It's on Facebook. On Facebook, it's MOMS. And I'm also on YouTube. I'd love to support you, to educate you, and to empower you. Thank you for watching. There you go. And for that motherhood journey, for us to support you, to continue connecting you with experts like Shiro, I'm your girl, Christine of Supermamas, SUPAMAMAS, like an international brand. You can always reach out on Instagram, Supermamas Kenya, Facebook, Supermamas, and on my personal profile, Christine Kasina. Thank you so much for joining us.